Welcome back, everyone. All right, do you suffer with chronic knee pain? Well, for those who suffer from it due to osteoarthritis, there is a new FDA-approved procedure that'll get you back to living an active life, which is what we all want, right? So here to share more is Dr. Kendra Pearson of Restore Muscle and Joint. Good morning.
Morning.
Thanks for being here.
Thanks for having me.
I'm excited to chat with you about this. I had a knee injury in high school, and I was told that I might be prone to knee pain later on in my life. So walk us through some of this and go over GAE. Tell us what it is.
Well, genicular artery embolization it's a cutting-edge, image-guided procedure that targets the knee pain caused by osteoarthritis in the joint, which is actually inflammation. So what happens with osteoarthritis is the body creates extra unnecessary blood flow to the knee, which actually causes a chemical irritation to the knee, which increases inflammation, drastically increases the pain. So a genicular artery embolization, or the GAE, our vascular specialist actually takes tiny particles and blocks those unnecessary, unwanted blood vessels. And when you reduce that blood flow, you actually reduce the inflammation, drastically reduce the pain, and then you're able to increase the patient's function and mobility. It's all without surgery, without stitches, without a lengthy recovery.
Wow. And the name sounds so fancy, so it's got to work, right?
Right.
Yeah. Okay, so who does this help, and who would be a good candidate for it?
So absolutely, a good candidate would be anybody, any adult with either mild, moderate, or severe osteoarthritis in their knee joint. If they're looking to reduce pain, if they're looking to either avoid a knee replacement surgery, or maybe put off a knee replacement surgery, or they're not a candidate for that type of surgery, and they're looking for something that's minimally invasive, that's going to reduce their pain and increase their quality of life.
So for people who have tried other methods, they've tried injections or physical therapy or maybe surgeries or other things like that, medications, they might be hesitant, or they might not know if this would help them. Is it still an option for them? Can they get relief from this?
Yeah, actually, that is who it's for. This is for patients who have already tried medications and failed, injections, physical therapy, but they're still struggling with pain, and they're wanting to avoid or put off that invasive surgery. They're looking for something outpatient, minimally invasive, that they can get back to doing what they want to right away and reduce that pain.
Okay, so tell me some about the recovery process.
Yeah, absolutely. So the procedure is just about an hour long. And patients are up and walking within 24 hours or even that same day of the procedure, back to their normal activities within 24 to 48 hours. Significant relief within the first couple of weeks after the procedure, and it continues to improve months after. Pain relief can last 2 to 3 years after the procedure, and if pain does return, they can repeat it if needed. So downtime is very minimal, and patients are able to get their quality of life back and reduce their pain and get back to doing what they love.
Those are incredible results. Now, the thing I think of course, I'm sure a lot of people at home are thinking this: insurance. Is it covered by insurance?
Yes, absolutely. Most insurance payers, including Medicare, cover this procedure. If you have tried the standard of care already, so you've done injections, you've done therapy, you've taken medications, and you haven't found relief, or you're still having pain or pain returns, this is when Medicare or insurance can cover it. At our office, we do a complimentary benefits check, so we hold our patients' hands through this entire process. We also do our due diligence to make sure that this procedure is right for the patient. So we actually have a unique combination of orthopedic specialists and vascular specialists on our team that collaborate in patient care, review their history, review their exam, make sure this is the right fit, and then we can get pre-authorization and make sure insurance covers it for our patients before they move forward.
Wow, doctor, this sounds absolutely incredible. I know a lot of people are going to be excited to hear this. So thank you so much for being here and sharing this information.
Yeah, I love it.
All right, you guys, for more on GAE and to see if you qualify, visit restoremuscleandjoint.com to make an appointment. Like she said, they offer a free consultation and complimentary insurance benefits check. All you have to do is mention Great Day KC.
The following portion of Great Day KC was sponsored by Restore Muscle and Joint.
Coming up in our next half hour, our Hollywood Beat, we are looking at some new animated movies your kids will love, and one that includes a sequel to Zootopia. And the Love Fund School Supplies Drive is in full swing, but hey, there's still ways you can contribute. We've got the details after the break.
Home of the Oaks Advantage. Frictionless and in and out in about an hour. Shop your way.